Should we begin?
Yes, please.
Yeah. Hello, everyone. Good morning, good evening, good afternoon. As you know, our participants, viewers would be from different countries, different time zones. So I, Dr. Apurva Kumar Pandya, Director at Parul Institute of Public Health, welcome you all to our webinar on digital storytelling, a participatory research approach. So as we all know that participatory health research is a known methodology, but since last 1 decade, people are talking more about it. It's a process where we engage community as part of research, not as participant, but equivalent to researcher, and empower through the process of research, and the end product is to improve health status or improve access to healthcare services. So participatory health research is a process of empowerment for both researcher as well as community members. So as part of participatory health research, one of the innovative methodology is digital storytelling. So today we have with us an expert, Dr. Kriti Vasist, who is a faculty member from McNeil State University, USA, who has been using participatory research approach as part of her research. And today we are privileged to have her for this webinar. So I welcome Dr. Kriti Vasist as part of this webinar. And before we begin the webinar, I would like to introduce her to all of you. Dr. Kriti Vasist is affiliated with Department of Psychology, McNeil State University, Lake Charles, Louisiana, USA. And she's working as, she's taking care of undergraduate and graduate courses in psychology, particularly counseling psychology. She's actively engaged in research, and participatory health research is one of her key area of intervention as well as research. She supports the community agencies with interdisciplinary projects like Street Soul to promote mental health literacy. She is expert in human rights and research through her efforts in civic engagement, community engaged research, capacity building projects. Some of her, glimpse of current research include a digital story project on mental health stigma and body mapping, study on LGBTQ identity. Her future project ideas include exploring more participatory, qualitative methodology, especially symbolic interactionism, framing a study on mental health and climate change, and creating psycho-educational advocacy campaign for LGBTQ mental health. So she has been promoting positive mental health and engaging with community since long. So I think it is our pride and privilege to have her on this webinar and share her experience of working and utilizing, implementing, adapting participatory health research, particularly digital storytelling as a novel approach. And I believe that this webinar would be very useful for all PhD scholars and MPH scholars and public health professionals alike. So with this, I would like to hand over the webinar to Dr. Kriti Vasist.
Thank you so much, Dr. Pandya, for such a warm welcome. I am delighted to be here. So I'll keep this short. I hope that we could have done this in person so that it could have been more facilitative and we could have lived through the idea of participation. But anyhow, with the limitation, we will start it. I am going to share my screen now with the participants. Okay. So you all know about myself, that my name is Kriti Vasist. I have done my PhD. I have completed my master's in India, which was primarily in social psychology. And then I took a route with mental health and women health. Today's presentation is on digital storytelling, which will be, in short, I will be calling DST, participatory research approach. Before jumping on or starting the presentation, I would like you to visit this organization, for which I will stop sharing and take you to the link myself. Let me just, okay. I'm trying to figure this out. Meanwhile, one second. Just a second. Okay. So this is, yeah. Finally got it. Okay. So this is the organization link called Story Center. And what is the relevance of taking you to this website is, this is the organization, this is the agency that started DST in the US. So it is definitely a good resource for all the students who would like to pursue digital storytelling. This agency and organization, they started DST for advocacy purposes primarily, but now researchers has been using this research methodology for research and for the advocacy purposes as well. What is the fun part of visiting this website is you will find out many workshops that are paid and expensive. But here is a thing that you can also access the free online webinars. So now we know that all the participatory researchers, especially who are practicing in health research, they are very eager and curious to integrate research methodology, which is critical and participatory in nature, but how they can involve technology is something that they are curious about. So you will learn about that, how you can use podcasting and other tools to promote the advocacy and action part, which is a prime thing that we want to do in the health research. So you can visit this website. You might find some good resource. So now I'll stop sharing that and we'll take you back to the presentation. Okay. Okay, I think this is going to be okay. Hope this is clear to you all.
Yeah.
Okay, so okay. So before jumping on to what is DST and what is this research design, let's just talk about the participatory research methodology. Dr. Pandya has definitely given us a glimpse of why we are talking about participatory research and how this is getting into a trend these days and the relevance of it as well. So before jumping on to participatory research methodology, I would like to talk about the idea of philosophies that helps us frame the research approach and select the research design. So there are many philosophies of research. I'm sure that you must be aware of positivism, constructivism, etc. Participatory research methodology, participatory research approach is a part of a philosophy which is based on critical pedagogy, which is a part of critical consciousness and action research. Now, I'm not going to talk about the other philosophies, but let's just focus on what are the critical pedagogy. Critical pedagogy relies on the idea of power and privilege. Dr. Pandya was sharing that how the idea of that research should be equal. The participant should be an equal partner in the participatory research approach. That's the idea of critical pedagogy and critical consciousness as well. So when you pay a lot of attention to power and privilege and how that's translated into your day-to-day life, especially if you are a researcher or a doctoral student, you will be interested that how critical pedagogy is translated into research. Participatory research methodology or approach is an example of that. When you are talking about creating an empowering process for the participants, where you are not as a researcher coming up with the research problem, you are not the someone who will choose from the research the available research framework, that this problem that I have come up with, this will fit into this kind of research framework. And then you design the data collection tool, be it survey, be it other kind of data collection tool. And then you go out in the community and include the participants in, maybe in 40 to 30% of participation level. And then you create the results. So this type of philosophy and research approach was criticized by a participatory researcher, and they wanted to facilitate that kind of process where the community is coming up with the problem, community is designing the research framework, and community is a part of data collection process and data analysis process as well. When you take one step forward in participatory research, you will talk about the action and the advocacy aspect as well. So when you talk about action and advocacy part, I mean that how you are not stopping as a researcher after the data analysis, because when you are in a field where you are a practitioner, you are a researcher, and you are an educator, you want to be involved in some kind of change process as well on the community level. When you are designing program, when you are implementing the program, you want to be not only engaging in research, but also thinking about how I can create that kind of change, or how I can be more active in the implementation of those results. So DST is a product of that. It's definitely a participatory research, and we will talk about that. But it's also an action part of the research design. Why? Because you do not stop only after the data analysis. You create those stories, and then you can share those stories on various platforms and advocate for the kind of issue or the topic you are interested in. So now, why do you think that DST is a participatory research methodology? First foremost is that stakeholder is a integral part of this process. When I'm saying process, I mean a DST process. Now, your question could be, what are the stakeholders? Stakeholders are people, organizations who are invested in your project. So it could be, for example, if you are designing a program for vaccination, so whosoever is invested in that kind of program will be a stakeholder. So the idea of participatory research methodology is to include all the stakeholders in the process of creating the knowledge. So DST also include that assumption into the process. You actively involve people and community in identifying problem, formulating plans, and implementing decision, as I discussed. However, participatory research can be understood on a continuum. So sometimes it is possible for you to 100% include all your community members right from the starting. But sometimes for the feasibility of the project, or it's not very sometimes practical to engage in engaged research, because it is time consuming, and sometimes there are other constraints as well. When you engage with vulnerable population, recruitment and retention is a major problem as a researcher that you will experience. So on the continuum, as a researcher, you try to be 100% community engaged, pursue community engaged research, but you can be flexible on that continuum. So and then the third point is individuals also are part of the action that you are creating after the research project. So the DST or the stories or advocacy that you are developing after your results include your participants. So it's their voice that coming to the front, and that's also a process where you are increasing their capacity as well. So you organize an event after the research is being done and maybe invite policymakers and give space to the participants whose voices are unheard, and they can share the voices in terms of credible data. And then it is important to involved stakeholders because of the sustainable development and sustainable change. Because when we are looking for long-term engagement and long-term change, it is very important to understand the community and the social and cultural and maybe the political part of the community. So these are the facets of participatory research methodology, which is in line with DST. Now, what is DST? DST is basically a digital media production which combines audio, images, video clips, and by combining audio, images, video clips, you try to tell a story, you present an idea. And DST is made, it's primarily designed only for 2 to 4 minutes. It's not a long story. It's only a campaign sort of a story. So DST involves stories from individuals. It can have a story from group, institution. It can have stories from history. So so DST is basically combining audio, images, video clips, and you try to share that story on various platforms. In DST, in short, what you do is you compose a short script about some aspect of your own life. It could be your own life. Sometimes when you are doing the research, it is, especially with the vulnerable population, your research review committee doesn't allow you or maybe ask you so many questions about privacy and confidentiality of your participants. So sometimes it is not very, it is not possible to include your participants directly into your movies. But then if that's the case, what you can do is you can create the characters and do the voiceover from your participants that can create a powerful story, because with images and audios, you do have an impact on a larger audience, and which is powerful. And you can also maintain the confidentiality and privacy of your participants. So there are 3 types of DST that you can create. First is personal. Like I said before, personal narratives are more about when you are taking someone's personal story into your research, and then you are using DST to advocate for their life or advocate for their issue that they are dealing with. So personal narratives includes those. Historical documentaries are those kind of DSTs or those kind of documentary that captures past events that may have influenced your community in a powerful or influential way. So whenever you include past events, that's your historical documentaries. And then our third one is content area stories. So content area stories are those kind of stories that are basically based on a specific topic. And this specific topic can be from any discipline. It could be from mathematics, it could be from social science or sociology, etc. So when your story is not about the personal narrative or the historical events, but about a topic, then that's called the content area story. For this presentation, we will be talking about the personal narratives. Okay. So what is the use of DST? When I will say that what is the use of DST, you can construe the meaning that, you know, that we are talking about DST because, we are talking about participation. We are talking about the power and privilege that happens in the research process. We are talking about the action research. But more than that, it includes that you are providing your stakeholder with the control over the research process. So, and like Dr. Pandya was referring to, that the process is not only involving the stakeholder, but that also involves that how you can empower the vulnerable population by including them in the research, providing them with the space where they can think critically, they can think about what can be done to maybe improve the community issue they are facing with. So that's one first use of DST. And second one is the voices of several unheard who are discriminated socially, economically, and culturally. They get a space to share their everyday challenging histories. So we know that participatory research is all about the power and privilege. So hegemony, when you question hegemony, hegemony basically means when you are questioning the dominance of one cultural group or one agency or one organization. To break that status quo, you need to do a different thing. But as a researcher, as someone who is practicing health research, what you can do is you can provide space to your community, you can provide the space to your stakeholders in your research when you are designing a program or maybe implementing a program. And that's how you are challenging the status quo that doesn't allow the community voices to come on front. So that's the second use of DST. It is a qualitative research methodology, clearly, and this will provide a framework from which you can understand the stakeholders' point of view instead of researchers' point of view. That is one of the criticism, that it is not only designed by the researcher, it includes the stakeholders. And it's a parallel process where researcher and the participants, they are understanding and learning about the issue or the topic that they are exploring together in the research process. So that is why when you talk about the researcher role, I am sure aware of ethic and emic perspective if you are a doctoral student. So in participatory research, when you talk about DST, which is a part of participatory research, the role of researcher is of facilitator and not of researcher. So sometimes I have seen participatory researcher who are really passionate about the field and who really think that community should be involved. They prefer to call their participants as co-researcher instead of participants, because that's the idea that you are even questioning the language and the discourse that is happening in the research process. So you are not only questioning through the research process, but the language you are using to refer to your participants. Now, what are the basic steps of digital storytelling? Before jumping on to the basic steps of digital storytelling, I would like to talk about that how research is understood. So as a researcher, you have a philosophy, right? You have that, I am someone who is more aligned with participatory research, who would want to engage in action and advocacy research. So that's your philosophy. And based on your philosophy, you choose your quantitative approach or qualitative approach, your research approach. Participatory research can be done in both approaches. It can be qualitative, it can be quantitative as well. However, DST is a qualitative approach. So you have philosophy, you have approach, and then you have a framework. Now, which is a research design, you also called it research methodology. DST is a research methodology. Now, how you can understand research methodology? For example, if I'm visiting your campus and I ask one of the students that, can you tell me the way to your canteen? And the students maybe, tell me that, go straight, take right, take left, there is a roundabout, and maybe you will find the canteen right in front of that, right? So this roadmap will guide me that how will I go to the canteen, right? So research methodology serves the same purpose in the research process. It will give you a template or a map that how you should be doing or facilitating your research. So DST will give you that framework. Now, this framework will be based on what is the purpose of the story and who are the audience. So you have to have a very clear idea that what is the topic you are exploring, and then what is the theme, what is the key message, and then you draft a story. Now, these are the steps of creating DST. So you have a roadmap to go to canteen. Now, how will I go to canteen? Whether I'll walk or I will rent a bicycle, or maybe I'll take Uber to go to canteen, is an idea of data collection tool. So DST just give you steps to create a digital story telling. There are different data collection tools that you can choose to first get the story out of your participants. So when you are describing the purpose of the story, when you are describing the theme and the key message, you are drafting the story. So this story has to come from the participants. And how will you do that? This will be based upon the data collection tool. Now I'll stop sharing and I'll take you to the other document that will help you understand that what are the different data collection tools you can use. Before that, let me. This one. Okay. So I'll use an example that I am using in my research process. So I have designed one research on mental health stigma, and I'm using DST to DST research methodology. So this research is done in several phases, but what are the data collection tools that I'm using? So I have decided that I'll do a focus group interview. But because this is a participatory research, I looked for, so the focus group interview, which is traditionally done in, you generally ask questions to your participants, and then they, share their stories about stigma, what are the causes, what should be done, etc. I chose, instead of questions, I do have questions, but I chose some participatory research data collection tool, not the methodology, to facilitate that focus group. So first one is stigma mapping. So what is this? According to this tool, we ask participants questions about what is stigma, and the idea of stigma is not restricted to their own personal experiences, but we also try to find the link between that, how this stigma is understood from a social, cultural, and political aspect. For that, what we can do is we can ask participants to, I'm still conducting this research. So participants go to the community, which is the college campus for us. They will go to the community and they will recognize the location. They can recognize any department. They can recognize any narrative that promotes stigma related to mental health accessibility on campus. So then they come to the a room back, and those artifacts that they have chosen, that they have selected, that signifies stigma for them, that will help us facilitate the discussion and the interview on what is the stigma. Why do you think that this is, this is something that is relevant or critical in this context? ours is a very conservative community. So I'm sure that there will be n numbers of narrative related to social and political aspects of it. So that's stigma mapping. Then we want to know the causal factors of those stigma, maybe digging deep into the social cultural aspect of it, because when you are going to design an intervention to curb mental health stigma, we need to make sure that, you know, we are including those social and cultural barriers into our interventions so that the intervention can be sustainable and long lasting. So the second tool that we are going to use in the same focus group interview is problem tree. So problem tree is basically an artistic way of asking, you know, what do you think could be the causal factor of stigma? When you are talking to a vulnerable population, not only vulnerable population, you really need to think from the perspective of your participants, your co-researcher. And I think participatory tools, creative tools give you a space to understand those technical technical topics in a very layperson language. So it is good to use those kind of data collection tool in your research process. So in problem tree, we will create a tree. We will have a trunk of the tree, and this trunk of the tree will have all the cards about the stigma that they have understood from the mapping stigma participatory data collection tool. So that will have, okay, this is stigma according to the group. And then we will branch out the branches, we will have the leaves, and these branches would be the causal factor. So we will ask them, okay, so if this is the branch, what is the causal factor for this, this stigma construct? So that's how we are going to create the problem tree and have an idea about that these are the social and cultural causal factor of stigma in the community. After that, there is another tool that we are going to use in the focus group, which is ideal scenario. In this, this is like a ideal question that you ask your participants, that if, you know, there is an ideal scene for you, or if you are in a dream and you open your eyes and you want to see that there is no stigma around you. So what kind of scene is that? What is your assumption? So this could be something that they wish for, or the solution that they are providing in terms of stigma that is prevailing in the society, or this could be a wish that they feel that, you know, this should be the scenario. They may say that I do not want my parents to question my sexuality related to LGBTQ, right? Or maybe I want my parents to be more supportive of my sexual identity, right? So this is the ideal scenario. And the idea behind choosing these, only these participatory data collection tool to collect the story or to draft the story under DST is because we are going to create a digital story which can talk about what is stigma from the community perspective, what are the causal factors, which is very local to the community that we are pursuing this research from, and what are the solutions. So now I'll stop sharing this and we'll go back to the presentation.
But what has happened over the years that instead of getting
Okay, so now when you write your manuscript, when you conduct your research, you have to have a statement of the problem. You know, what is, you know, why you are doing this research? What is the purpose of this research? So when you say that what is the purpose of the story, that's the thing. Mental health stigma is the purpose of the story. Now, what are the audience? Because we are doing this research with college students. So our audience is definitely the primary stakeholders are the college students, but we are also targeting the local community because this is very conservative, and mental health stigma is a major thing that the young population struggle with. Then we decide the theme and the key message for our DST. The theme and the key message that we wanted to convey with this DST was, what is the stigma, what are the causal factors, and what are the solutions? Plain and simple. Then comes the drafting, the process of story, which will be done after the data collection. That will be done through the participatory data collection tool I just discussed, which was stigma mapping, problem tree, and ideal scenario. There are tons of participatory data collection tools that you can include in your research process. After the story, there are elements. After collecting the data, what you do is you ask each of your participants to draft a story, and this story should have what is stigma, what are the causal factors, and what are solutions according to them. And then this story can be written in first person or third person. They can talk about, I believe stigma is this, or they can talk about, they can assign a anonymous or a random name to the character, and then they can talk about maybe Madhvi is is a native of Louisiana and she thinks stigma is this. So it can be written in first person and third person. You can determine the location of your story and map the story. So if you are someone who is interested in qualitative research, you must be aware of narrative inquiry, that in narrative inquiry or any story, you have to have introduction, you have to have a body, you have to have a conclusion, you have to have a situation, conflict, or message. So make sure whatever DST you are trying to create, it have a certain pattern that you are following. Then after drafting the story, you share the story within the group, and people provide feedback and make sure that the story is only drafted for 2 to 3 minutes. DST is not a long storytelling way of providing the data, so it has to be short. And then the next process is, after drafting the story, after finalizing the story, the main aspect of DST is using a lot of visuals, using additional illustration or images to promote the action and the advocacy part of it. That's how you can make the data more powerful. So in my project, I will ask my participants to, after drafting the story, to draw that story on a piece of paper. So maybe they will have 4 or 5 A4 size sheets, and they will draw that story on that. And then we will click a picture of those images. And then, okay. So when we click the pictures, we will scan the illustration, or we can use the images. You can use different application to do that. If you are scanning the images or illustration, you can use ScanCam, but we will be using an iPad. So we will be relying on inbuilt iMovie application to or the camera, first of all, to click the picture and maybe edit the pictures. And then once we have the pictures done, we will make sure that they are in line in the order of the story. And then after, when we are done with it, what we do is we do the voiceover. So previously I was talking about the confidentiality and privacy, especially when you are involving young or youth population. They are not eligible to even sign the informed consent, even if you reach out to their parents. So sometimes confidentiality and privacy is a big thing. So you cannot record them directly narrating their story. So that is why we chose to have those drawings and clicking those pictures, and then making sure that they are lined up in an order. After that, we will do a voiceover. Voiceover will also be done by the application inbuilt in an iPad, which is, I think, a voice recorder is something that we will use. And then we will record the voiceover. We will not add any music, but you can add the music. And then one of the things that a researcher or scholars follow when they pursue any kind of participatory research is they do provide the authorship and the credit to their participants. So it is something that you can definitely do if you are creating a DST. Now, there are the basic rules that you should be following while creating DSTs. Make sure your narrative and your images, they match. So when we are doing the voice over, so whatever images that we are showing on the video, on the camera, it's something that should match with that. We need to record the voice over. Okay, that's done. What else? Permission is something that you take before starting the research. Make sure that you have gone through all the organization policy. It's related to privacy and confidentiality, and follow a natural conversation when you are doing the voiceover. Certain things that you should be aware of while recording the audio about the clarity, that the video quality and the audio quality is good. Making sure that there is not a lot of noise when you are little to no noise when you are doing the voiceover. So we will be using lapel mic. It's a small mic that you generally see YouTuber carrying to record their video. You can also, if you do not have that lapel mic, what you can do is you can just plug in the earphones and record it. That way also, it should be loud and clear. Okay, now I do have the list of application that you can use when you are creating a DST. We rely a lot on Apple applications. Okay, so this is it about DST, that what is it. But before finishing up this presentation, I do have an example of DST that I have created when I was a young researcher back in India. It was in Delhi. Hope you will enjoy that. For that, I will stop sharing. I have 2 of those, but let's see which one. Okay, so I'll play this one. I need to share that first.
I think voice is not audible.
Clear?
Yeah.
Okay.
So
Let me increase it.
okay, so I think perhaps you may need to set again, and you need to click on
Okay.
option. That you can set it again.
Share sound as well, maybe optimize the video clip.
Yes.
This and share. Hope this works. Let me know if this works.
कहानी का नाम है अपना भविष्य।
Yes, it's working. Can you make it on full screen?
कई जाति के लोग रहते हैं, सभी इतना मिलजुल कर रहते हैं जैसे एक परिवार हो। वहाँ मैं अपने मम्मी पापा और मेरी गुड़िया जैसी बहन के साथ मिट्टी से बना हुआ छोटा सा घर में रहती हूँ। जब मैं छोटी थी तब हमारे गांव के स्कूल जहाँ 200-300 बच्चे रहते हैं वहाँ पढ़ाई की। आगे की पढ़ाई के लिए मुझे गांव से 4-5 किलोमीटर छोटी सी शहर जैसा इलाका में जाना पड़ा, जहाँ कई गाड़ियों की आवाज़ें और शहर की भीड़ भरी जिंदगी देखने को मिली जो पहले नहीं देखी थी। और इस स्कूल की सहायता से मैं +2 कंप्लीट कर सकी। फिर आगे की पढ़ाई के लिए परिवार वालों का मन नहीं था, क्योंकि पढ़ाई का खर्च नहीं दे सकते थे। लेकिन मेरे एक दोस्त से ऐसे इंस्टीट्यूशन के बारे में सुनी जहाँ फ्री एजुकेशन मिलता है, तो घर वाले भी हाँ किए। फिर मैं मेरी दोस्त की सहायता से इस इंस्टीट्यूशन में पढ़ाई कर रही हूँ। मुझे लगता है यह इंस्टीट्यूशन मेरे जैसे कई बच्चों के लिए स्वर्ग के समान है। लेकिन जब मैं गर्मी के महीना में छुट्टी में घर गई, तब मुझे घर वालों ने आगे की पढ़ाई के लिए रोक टोक मना किए, क्योंकि गांव वालों मुझे बोले कि तुम किस काम की, तुम तो शादी करके दूसरे घर चली जाओगी। वैसे भी लड़कियां सभी के लिए एक बोझ हैं। लड़कियां जितना भी पढ़ाई करे, चूल्हा ही फूकेगी। अगर लड़का होता तो हमेशा अपने पास रहता और देखभाल करता। गांव वालों के इस बात पर घर वाले मुझे मना किए। तभी मुझे लगा मेरे पैर के नीचे से जमीन खिसक रही। मुझे बहुत ही दुख लगा और अकेलापन महसूस हुआ। तभी मैं सोच ली कि लड़की होकर भी कुछ करके गांव वालों को दिखा दूंगी। लेकिन इंस्टीट्यूशन का आने के लिए पैसा कौन देगा? तभी हमारे गांव में एक नया स्कूल बनाया जा रहा था, तो वहाँ काम करने गई और उसी पैसा से मेरे जिद्दी से यहाँ चली आई। अभी मैं मेरा पढ़ाई कंटिन्यू कर रही हूँ और मेरी उम्मीद है कि आगे जाकर पढ़ाई खत्म करके कुछ बनकर गांव वालों के सामने एक नमूना बनकर दिखाना चाहती हूँ और बताना चाहती हूँ कि एजुकेशन सभी के जीवन में कितना इम्पोर्टेंट है और एजुकेशन सभी के लिए ज़रूरी है, चाहे लड़का हो या लड़की, सभी के लिए मायने रखता है। इसके लिए परिवार वालों की सहायता चाहिए। थैंक्स।
One second. Okay, so this was one DST that I have. I have another one. If if the participants and if this is something that we can show as well, or otherwise I can share the link. But in nutshell, this is how the DST will look like. You have a topic. In the example, we were talking about the importance of education and how in a rural village in India, how education and how a girl will go through the social and cultural barriers, to access the education. So in a short and sweet DST, we could not only talk about the struggles, but we also talked about, we started with introducing the character, and then we talked about the social cultural barriers, and then we talked about that how this participants overcame the barriers that were set in front of her. So that's the idea of DST. I will definitely share the DST that we will create related to mental health stigma with Dr. Pandya, so that you can review that. I know that we still have time, and I do not have a lot to share. This was my presentation, but I can definitely answer some questions or feedback that you all have. So yeah, over to Dr. Pandya.
Yeah, thank you very much for your interesting presentations. We do have questions. I have received questions, so let me check and ask you without wasting much time. So one of the question by our student is, how do you ensure confidentiality of participants in DST?
It's a good question. So when I was writing the IRB, so the idea of community engaged research is all about keeping the participants in front and their voices in front. So, and I think when you read a lot about participatory researchers' ethics related to the traditional ethical research that's been done, you will realize that confidentiality and privacy is something that is a very, very situational in participatory research. So with this participatory research, I clearly mentioned that this is a participatory engaged research. The idea, the very premise of participatory research is including the participants and making sure that, you know, they are using the space to share their stories and to ask maybe the policymakers or to the people who are in the position to create some kind of change. So the idea of keeping their identity private is not the idea of the community-based research. So when you write the IRB, when you are writing to your review board or you are presenting to your committee members, I think you can argue that, you know, this is the idea of community-based research, and the idea of privacy and confidentiality is very situational in this context. So yeah, that's my answer. I hope that I answered your question.
Yeah, certainly. So I just would like to add few points here that, you know, here remember the participants are also researchers. So it is they who will decide whether they would like to open their identity or not, and it's depend on that them and researcher and participants together, you know, address the ethical issues, including confidentiality in participatory health research. So there is another question: what is the impact of DST in research compared to other methodologies?
Okay, so I am trying to understand what are the other methodology, but then DST is I think is an innovative way of engaging and integrating technology, action part, and the participation in the research process. So DST is definitely an amazing tool for someone who would like to share those stories with the community. So I think that's the advantage of DST. With other methodologies, I think there is no comparison because every research design have their own purpose. But when we are talking about action research, when we are talking about participation, DST is definitely a tool that we rely on. There are other tools as well. For example, photo voice is something that we can use. There are photography photo narratives is something that one can use. One can use podcasting as well. There are other innovative research methodology that one can use. I think the idea of using images and videos and audio is that you make the voices of your participant more powerful. Whenever you see an ad, when you know, a Lay's ad or maybe a jalebi ad of Saffola, so you would want to go and have a jalebi because the audio and the visuals are so powerful. So I think that's the idea behind DST as well.
Yeah. So I think we do have many questions, so I will be very quick in asking. So if DST is purely qualitative, how do we deal with triangulation?
If it is quantitative or qualitative?
Qualitative.
Qualitative triangulation. So I think by using various data collection tool is something that you can make sure that triangulation is the idea of triangulation is involved in your research. Other could be when you are doing the DST, you can ask your research assistant to maybe write the observational notes. You can, as a researcher, when you are engaging your participants in the idea of, data analysis or something, there's definitely a chance to, keep the biases in check, not only of your as a researcher, but your participants as well. So these are the way reflective memos is something as well. So there are ways you can make sure that triangulation is involved in the research.
Yes, so I just want to reword what Dr. Deepasist has said, that triangulation can happen at three stages. One is at a methodology level, which is known as methodological triangulation. The second is during data collection. So data collection triangulation, and the third one is data analysis. So during analysis, so triangulation simply mean using different tools and analyzing together. So use of different tools, it means you're triangulating with different tools at methodology, at data collection, and data analysis level. So very basic question, whether this DST is qualitative or quantitative?
DST is qualitative. Why? Because it's like narrative inquiry. Narrative inquiry is qualitative but not action oriented. You capture the stories by conducting the interviews, etc. But DST is similar. You collect the stories, but with different data collection tools. So it's purely qualitative and action oriented.
Yes, so I think this answer has partially answered another student's question. Would it be wrong if researchers use DST in a quantitative research to provide feedback, to provide backup or guide during report writing?
I hope that I'm understanding it right. DST can be combined with any quantitative research methodology. Yeah. I think it can be combined to other methodology. However, I haven't seen any idea of such, but definitely I'll encourage you to do that, to combine the quantitative research methodology with DST. It's definitely mixed method is more powerful than choosing any of the approach.
Yes. So I think we'll take two questions. So one is, what is the parameter of DST? I think that has been discussed in the presentation, but I think if you can summarize.
So what is mean by parameters? Are the assumptions is that the question?
Dr. Jaideep, can you unmute and ask? Because it is a question asked by Dr. Jaideep Chauhan. I think he is not there. So yes, okay. your question is right, that what does he mean by parameter, because that may have different meanings.
Assumption, I think.
Yeah.
So in DST, we do have certain assumptions, and I think it's purely related to the participatory research. One is that what is the role of a researcher? So it has to be facilitator. How much we are involving the stakeholders. It is something that should be on the continuum of participatory research. So that is one assumption, not the assumption, but that's the feature of a participatory research, that participants and the stakeholders are included. And then the data analysis part and the data collection part has to be participatory in nature. What else? It has to have, I mean, you need to come up with the themes, and you need to create a story, and then you need to record it. I think these are the assumptions, not the assumption, but these are the ways that you conduct DST. I really have a hard time understanding the parameter aspect of it, that what do you mean by it, but I hope that I answered your question.
Yeah, so I think we still have 2-3 questions, but I think we can take one question and then okay. Would like to end, and perhaps I can post questions to you. Sure. If there are many, and we can get answers and share with students. So one of the students' question is, what is the authenticity of a story said by a person? Is there any scope to prove the story said by victim? How a researcher triangulates story? I think few of the questions have been answered, but you can just answer what is the authenticity of the story, and any scope of proof the story said by victim. Actually, even I don't understand the second question.
Okay.
So Kazi, if you can, unmute yourself and ask yourself, because the second point is something that I don't understand. Is there any scope to prove the story said by the victim?
I can try to answer it. The authenticity of a story, we do not question it. Why? Because I think recruitment is the part that we make sure that we are including the community in our research. When the community member is sharing their stories, they are sharing their personal stories and they are authentic. However, if you are talking about whether the data that we have collected is credible and we can journalize it, that's not the very idea of DST and the participatory research or any qualitative research, because journalization is not something that we are looking at. We are looking at how we can make space for those vulnerable voices. So even if, and maybe that is why in qualitative and participatory research, it is okay to have less participants as well, less participants, less as like 4 to 5 to 10 to 15, right? So I think because individual stories are so powerful that you do not need a lot of larger data to support that. So I hope that I'm able to answer that question.
Yes, thank you very much. I think I would like to now stop here taking questions, and if there are questions, I will certainly escalate these questions to our resource person, and we'll get back to all students who have asked. So thank you very much, Kriti, for making this webinar, this concept very simple to our scholars, and it's really appreciative. And the digital storytelling is a novel technique which is being used in research, and I'm sure it is going to benefit our MPH or postgraduate and PhD scholars, and many of them can use as part of their dissertation. So with this, I would like to stop here and appreciate Dr. Kriti versus precious time, and as part of appreciation, I would like to share a certificate of appreciation. Hope you can see this.
Yay, thank you.
So on behalf of Paro University and Paro Institute of Public Health, I appreciate your time, and we are looking forward to collaborate on some of the participatory research approach where your students and our students can work together on some participatory research project. So with this, I would also like to thank all participants who could make to attend this webinar, and all those participants who have asked very nice questions, and will also come back to all those participants who have asked questions but we could not take those questions. At the last, I would like to thank all technical team members of this webinar series at Palo University. Without them, we could not organize such a webinar successfully. So thank you very much. And also faculty members who are there constantly supporting our students and our initiatives. So thank you very much to all of you. We'll be coming back again with webinar series particularly for PhD scholars on different methodologies. So this was the first initiative that we began, and we'll be continuing this sort of webinar series on research methodologies, which may be very helpful for our PhD and postgraduate scholars. So with this, I conclude today's webinar. Take care.
Thank you.